It is easy to use the Healfa Healthcare app. Go to Play Store and type HEALPHA Healfa, select Healfa and download it and install it. Once you have done, you can open it. Now, in my case, I already have the app. So I can launch it. Once registered, we will have a user ID and password and we have the Healfa app. Now let's see the facilities in the Healfa app. We have a timeline where we get to see all the visits I have made to the doctor. Let me take an example of 27th May visit to a doctor. Here I can see the prescription, the complete prescription with my vitals, with my complaints, with the medical parameters, medicines given, and the tests what they have given. They have asked me to do a complete blood picture, a platelet count, and an X-ray, and they have given some medicines. Now let's see where can I find these. Once we go here, we can find the X-ray here, right in the mobile, and we can see our blood reports right here, CBP, platelet count, RBC, everything. If I want to look at my report, receipt, I can click on that and see my receipt too. So everything is on one place. So we can find all the information of all the visits. In addition to, you see a small heart symbol. So if you click on the heart symbol, this is a very useful thing, especially during COVID and Corona or people having to monitor. Sometimes doctors ask you that you have to monitor your parameters. So you can also add and monitor your parameters at home whenever, as many times as possible. If he asks twice a day, just add one more time and then here go and record your parameters. So for example, we will do blood pressure 125 and then low diastolic as 92 and then pulse rate as 96, oxygen saturation as 95 and then temperature is 100 and then respiratory rate 27, right, and save it. Now this gets added to our parameters, one more parameter added. Now the doctor can see this and you can also see this. This is a big advantage when you are in COVID and your doctor asks you to monitor your temperature or BP twice a day or thrice a day. Very useful, I have found it. Then we have a COVID management tool which is very good what they have provided. Here, as per ICMR and Ministry of Health guideline, there can be an initial assessment done. The doctor would do an initial assessment, put the temperature, you see cough, running nose, sore throat, and all the parameters what we have, what are the comorbidities, and check for this one, and then they can save it. This is the initial one. In addition to that, they can also do regular monitoring when they are teleconsulting. Every time they can add here, and the nurse or the doctor can add your temperature 101 and then cough is still there, moderate, running nose, yes, moderate, sore throat, yes, mild, body pains, yes. Like this you do it and then you save. So this is what you can do in the COVID monitoring. Thereby it allows the patient and doctor to see the same parameters. And another feature which I liked in this app was the forums. We go to the forums. If we have any doubts and questions, we can put those questions and doctors will answer that. And that way we can be in touch with the doctors. And for patients, not the doctor side, the patient, they have a doubt, do they have COVID? There is a quick and dirty self-check. You accept, you do it for self and answer, have you traveled? No. Have you been in touch person? No. Are you a healthcare worker? Yes. Continue. Do you have fever? No, but I have a little bit of cold. Done that. I am having BP and then this is my risk score. And from here, with this parameter, I can book an appointment. By booking an appointment, we go here, look for a doctor who is suitable for us and take that appointment. So let me see if I can find something to book. Let me see if I can book something for Sudhakar. Here. No, tomorrow, day after. He's available on 15th, what type of appointment I want to take. I want to take a telemedicine appointment, and then I click OK, and thereby I select a thing and get an appointment at 2:30. I have to mention my complaint: cold and fever, right? So this is what we do, and these are the features. It's a handy tool, very good in this time to see the parameters and monitor ourselves and handle it.